Welcome to Section 4. I'm Sue Tebb, and I'm going to be talking with you today about exercise and CST, and also incorporating culture, or just being aware of culture as we perform and help people with CST. So exercise can benefit those with dementia. There was a study done, a meta-analysis of 40 studies that looked at interventions of exercise with people with dementia, including flexibility, strength, balance, and aerobic exercise. And they realized in doing this that it helped improve functionality and also physical well-being, but it was not necessarily connected to cognitive ability, or they did not see any improvement in cognitive ability. But they found that people with dementia should be exercising because of the outcome of having better physical and also functional abilities. So we looked at other guidelines for older adults and exercise, and one that we found was done by the American College of Sports Medicine and the American Heart Association. And they looked at, I think, really healthy older adults because as you see this, they recommended aerobic exercise, either moderate or vigorous, where on a scale of 0 to 10, moderate is 5 or 6 and vigorous is 7 to 8. And they are looking at 30 minutes 5 days a week or 20 minutes 3 times a week. And there's a lot of older adults that can't have that high level of aerobic exercise. But they also felt that healthy adults could also work with resistance exercise and also flexibility and balance. So we took the flexibility and balance and some of the resistance, and also looking at aerobic, but not on a moderate or vigorous level, but more on a very mild, slower level of exercise as we began to think about bringing it into our work with older adults with dementia. So there's all types of different exercise out there. There's walking, there's weightlifting, there's running, there's Tai Chi, there's yoga. My thing with that is people need to just move and be able to find something that they can sustain, something that they like, and something that they will continue to enjoy doing. So we also looked at the CDC, the Center on Disease Control, and what they suggested for older adults as we began to think about building what kind of program might work for people with dementia. And again, they felt that people need to be able to strengthen, they need to be able to have weights that help move, so either dumbbells or your own body weight. And they began to look at different ways that we could add this strengthening to people's lives so that they did not get bored. As a group, we decided we'd look at yoga. Look, yoga has a bad rap sometimes because it's thought to be a very high aerobic exercise that can only be done by people who are really flexible. But in truth, yoga is the part of yoga that is just the movement. The asana is a very small part of yoga. That asana or that body movement helps people begin to be able to calm themselves, to be able to use breath work, to be able to move themselves into a more meditative state. So we thought that with people with dementia, we would look at yoga because it does help people using their breath begin to tolerate some intense effects, begin to avoid some of the emotions that come up, and also be able to have better sleep, which is what people with dementia need, is they need to be able to fall asleep and have a more sustained sleeping time. It also improves that cognitive emotional integration, and it gives somebody a sense of mastery. We all want that. And so we decided that we would look at different programs that had been done with people with a dementia. And we found about 5 different protocols out there. The Alzheimer's Association, well, not the Alzheimer's Association, but the Alzheimer's Research Foundation in Tucson has done some studies with people with dementia using yoga. And there's been several others that did. And we took the different protocols that we found where people had been using yoga with dementia, and most of them had it was a time of about an hour program that the protocol did. And we knew we didn't have that type of time. We knew we had only 15 to 20 minutes. So we took the best of what we found in those 5 different protocols and worked up a small, mini little yoga protocol that we have been working with people with dementia. And this slide says early onset, but we found that we could use it with people with even moderate and some with very severe dementia. So it consists of helping people learn to breathe and to sit and to notice and to be comfortable with their body. So we do a couple of breath exercises, both alternate nostril and bee's breath, which help people begin to calm their bodies down and be able to maybe sit in the chair and begin to feel and listen to their body. And then we move them through some exercises that begin to move the lymph in their upper body and also their joints through neck rolls, making sure that we don't have somebody do a complete neck roll like all the way around, but having them move their head up and down and then gently to each side and then dropping ear to each side so that they're very cautious of the spine. And then we have them begin to do shoulder rolls and shrugs. We have them massage their ears and their face. And then we have them think about doing a lion's breath, because lion's breath uses the tongue muscle, which we don't often do. So I'm going to demonstrate lion's breath. And because it's a fun one to do with people with dementia. You have them take a nice deep breath in, and then you have them go, so they love it. So we do a nice deep breath in, and then we go, and what that does, it really helps them exhale, which helps them calm a bit. And like I said, using the tongue exercises that tongue that doesn't frequently get exercised. It also allows them to be able to follow directions. And then we ask them to stand. If they choose not to stand, or if they're not able to, we also demonstrate all of these can be done in chair. And we encourage them to select whatever they're comfortable with, because there's no right or wrong way. So we have them stand or we have them sit, and we begin to have them move from side to side. So we just kind of have them twist from side to side, either standing or sitting. And then we ask them to do some little hand and wrist exercises. So we don't often move this part of our body, and as we get older, it really does need to be moved more than just on a keyboard. And then we ask them to do a side bend and then balance work. And in balance work, we always make sure that they are near a chair and encourage them to hold on if they would like, and be able to go through a couple of balance exercises, have them come up on their toes, have them sit down. You can also do this in a chair. You could just, in a chair, you can have people just put their legs out and then have them move up onto their toes and see if they can't put some of their weight into their toes as they're sitting in a chair. Once you're finished with some of the standing exercises, then you ask them to sit down, and you're going to begin to quiet them down a little bit. First by having them bring their knees up to their chest, and we're balanced in yoga, so you do one side and then you do the other. And then you ask them to do a seated pigeon, is where they put one knee on top of the other leg and then press it down. If you want directions for these, you can find them on YouTube, where people have demonstrated seated pigeon, standing pigeon, leg lifts. So I would encourage you to go to YouTube and look at how it needs to be done. we end with them by using mantra and a mudra. And a mantra is a sound, and a mudra is a movement with finger positions. And we use sata na ma because it touches the part of our body that has the most sensory receptors, our fingertips. It also uses sound, and it also helps them with direction. And we encourage them to start out saying sa, ta, na, ma as a whisper, and then you build it up, and then you have them yell it, and then you have them come back down again to a whisper. And then you ask them just to sit and notice and have them really feel and think about how their body now feels after moving it, either in chair or standing, and now sitting and using sound and having that sound bring them into their body. The next section's on culturally aware and appropriate use of language and transition and activities as we're doing these CST activities with people. For me, the most important thing is, nobody's the same. We're all different. And we make the assumption sometimes, especially when we're working with people with the same diagnosis, that everybody's the same. But as you work with people, especially in CST, remember that we're all different. And so we come to that group or we come to that individual session with different experiences and different understandings. And when we see familiar behaviors, sometimes we make assumptions of the meanings of them. What we need to do, rather, is just ask what those behaviors mean to people. And so, it might not be a cultural issue, or it might be, but we won't know unless we ask. And so my suggestion, and the person that wrote these beliefs about cultural difference suggested that we don't assume, but that rather that we ask so that we better understand what someone is going through and what someone is experiencing, because it will be different than ourselves. Other suggestions is to become really aware of what your own values and norms are. I think that's the most important thing for me as I work with people, is to become really sensitive. And sometimes before I start a session, I'll kind of tune into my own body about where I am, but also any kind of biases or assumptions that I'm making because of the group that I might be working with, so that I become really aware of my own biases and my own assumptions, so that I don't take them into that group or into work with that one individual person that I'm working with. So it's an acknowledgement of my class, my education, my race, some of the things that have been important in who I am, so that I am very aware and hopefully don't take that in and make assumptions about the people that I'm working with. Family support is one of the areas that we get our culture from, and so just being aware of that. So often, whether we're religious or we're not, or how spiritual we are, or how we practice it, often comes from our family. And again, that's an awareness piece. Also, our job or what we've done in life influences our culture. And so as a person working with people with dementia, for me it's so important to understand what that person did prior to the dementia that they had. Did they work? If so, what? If they were a parent, where are their children? Are they a grandparent? So that I can better understand who they are as people as I'm going to begin to work with them. We also know that our values, our cultural values and beliefs affect the understanding that we have about our health and our mental health and other people's health and mental health, and how we communicate that. So an awareness of that is very important. because we need to know how people understand what dementia is and means to them and to their family. There's also sometimes in working with older adults, now that I'm an older one, I don't have that same problem, but as a younger person I did, is that generational difference within the person offering the service and those receiving. And I just ask you to be aware of that and to notice that and be mindful of it and to ask questions so that we can better understand as we move and work together. Another area to be really mindful of when you work with people is their environment. Where do they live? Are they in a rural area? Are they in an urban area? What's influenced them? What's been important in their culture? What's been accepted in society because of maybe who they are or where they live, as opposed to maybe others in the group or yourself as a facilitator. Many times programs need to be adapted because of culture, and this one, because it was developed in the UK, as we have brought it here to the United States, we've realized that we've needed to make some adaptations. They use pictures of the Queen and the royal family. We've made other changes where we're not using that. We're bringing in United States presidents, other politicians that are important here in the United States. But as you work with this, it's really important to be able to talk to the people that you're wanting to serve, to ask them what's important for them in their culture. So you might want to talk to the people that have the dementia, especially those who have an early onset, or those who have more moderate or severe dementia, asking their family members and their loved ones what they feel is important in regards to their culture and their values that we can incorporate into the activities that we do in CST with people. So I really encourage you to start with the people that you're serving and asking them before, so it's more of a bottom-up approach before we really ask others. And then getting information from healthcare workers and community people can also help validate what we found as we make changes to some of the activities that we use with the people in CST. Next, what we might want to do is, after we have redesigned some of the activities, is to try them out. And we could do this either in a CST group or we could have a focus group. So there's a lot of different ways that you could try out and see whether some of those changes that you're making are culturally appropriate. And then, as I said, you want to pilot test it. So you do actually want to work with people with a dementia and see how it flies, how it works with them. And then the final step is really to analyze it and to get feedback and then decide whether this is a keeper and it works, or whether you need to make some more changes and then go back to the people that you've been working with, the caregivers, the people in your group, to see how you might better adapt some of the activities.